Good evening, ladies and gentlemen. Good afternoon to everyone who's watching us from the Europe, and also very good afternoon to everyone who's watching from Middle East and various other countries. My name is Ruben Lobo, and on behalf of team DentistChannel.Online, I warmly invite you to the fourth day of the biggest implantology event of 2020, happening for the very first time all across the globe, and hence it's called as the world's first virtual dental implant expo. I hope you all have been doing well, you're keeping safe, and everything's fine with you and your dental practice. Ladies and gentlemen, yesterday we had Mr. Andreas Halamoda speaking on a very beautiful topic, which was simplified implant prosthetic solutions for your implant practice. We got a lot of reviews, we got a lot of positive comments, and we are very happy to tell you that he's back once again now with another beautiful session, something which has to be the future of implant dentistry. And the topic for today is precise, fully guided surgery. Ladies and gentlemen, it's a very special moment to have with us Mr. Andreas Halamoda. A small introduction about our speaker. Mr. Andreas graduated in science from Germany. Currently, he is working in the Argen Medical Productions, Germany, as a product manager. He is well versed with dental CBCT technology and its applications. He holds a diploma in advanced implantology and allogenic bone grafting. He's also an appliance expert for tapered connections and as well as allogenic bone graft. He's also an appliance advisor for digital implant treatment, surgery, software use, and prosthesis. Ladies and gentlemen, presenting to you, Andreas Halamoda live.
So, good evening, ladies and gentlemen, dear friends of implantology, dear doctors, dental technicians, and all of the interested among you who are participating. So I hope I am online because I cannot see me on the channel right now.
You are.
Everything is working.
We are not able to see your screen. Can you change your screen to your presentation screen?
To the presentation screen, I will try. Let me see, is it better?
Yes, sir, it's perfect.
Perfect, okay, good. So maybe that was the issue. So once again, a very good evening, ladies and gentlemen. So yes, some might have heard me speaking yesterday about the topic. We were talking about prosthetics yesterday. Today, I'm glad to be back and to be speaking with you about the precise digital guided surgery. This is also a very interesting, I would say it's the future, it's part of the future of implantology. So let's quickly start with a short introduction about what we will be talking about. We will have a brief introduction of the Argon Group, of course, and I will speak a little about our main product, but then we will run directly into the main topic. The main topic is, of course, that we will be talking about the general need for full guided surgery, because many of you, I guess, have not been practicing full guided surgery yet. I will also talk about the main issues that come with surgical guides and with the whole process, all the things you need to consider to choose the right system and the right protocol. I will tell you that you should watch like a detective for perfection of the whole protocol, of the whole process, and I will show you the details you have to consider. And of course, we will have a take-home message for you and a summary. And afterwards, Ruben will moderate a question and answer session that I'm looking forward. So let's start quickly with our company, where we are. Yeah, we are right in the heart of Germany, almost in the heart of Germany, a little bit towards the west. So if you do ever fly to Frankfurt, when traveling will be allowed again, please be sure to visit us. We are 45 minutes away from Frankfurt Airport, but the region that we are is very nice. We are a UNESCO protected World Heritage Site, as there are many castles in the Rhine Valley where we are located. Here on this pic, you can see the landmark of Bingen on the Rhine. It's also a very small castle, the so-called Tower. And if you like to spend the night with us, we will accommodate you here, the Reichenstein Castle. And in case you don't like the Reichenstein Castle, don't worry, there are 28 more of them, just very close nearby. So that's where we are. Yeah, and to speak about our group, you can see here a map of the world, of course. You can see our core business is of course in Germany, although we are still in Germany among the, I would say, slim and focused companies. Yeah, we have not a huge sales force. That's mainly me. But what is very, very important, except for, of course, your home countries like India, like North Africa, Middle East and Eastern Europe, is in this case, the United States. We are rapidly growing there. And the reason is very simple. It brings us to today's topic. More than 80% of the implants there are placed fully guided. Yeah. So to have a well working surgical protocol, fully guided, is vital to have success there. And our success there, it's concerning the size of our company, almost overwhelming. So that we are sometimes struggling to cover the demand. Yeah. So we will not only, we're also in this business where we have to do some implant planning, to do some milling, abutment milling and printing of surgical guides. We did this with the company Implant Solutions 3D, and we are co-founders of this company also here in Bingen. And coming slightly back to me, I did graduate in a completely different science, but I joined the company in 2011 as I have always been interested in medicine. And in 2015, I've been promoted as a key account manager for Germany. And since 2019, I got promoted as product manager, so that I'm really happy to share my experience that I have gained in these almost 10 years, close discussions, being close to customers and their demands and their needs to help the product to evolve. And the main product that we rely on, that we have been growing our business on, is our very own K3 Pro implant system. We call it, it has a very specific design. We call it the peri-protect design because it's as prone to peri-implantitis as no other implant system in the world probably, or very few others. Yeah? But so the slogan has always been free your mind from old-fashioned two-piece implant systems and switch to a modern one. Freeing your mind does also mean make it free of troubles and worries, because our product is really very trouble-free. And we achieve this with some aspects that are very important for sustainability. This is first of all the subcrestal positioning, which is for many of you still unusual, but there are many advantages of it. This is only possible by having designed a sloping and completely surface-treated implant shoulder, so that we have a bony seal around the implant shoulder. That's perfectly protected then. And a two-piece implant in this construction philosophy does only work if we have a more tapered conical connection of 1.5 degrees. So this has the stability and the tightness like a one-piece implant then when connected. Of course, we do have an osteoactive surface for a fast healing, and we produce the titanium, of course, we produce the implant, of course, from pure titanium grade 4. As we are very prone against peri-implantitis, we have discovered when developing the prosthetics even further, a topic that we had been discussing yesterday, we are able to keep stable tissue. So, not only stable hard tissue, but also stable tough soft tissue, because there's no stable soft tissue if you don't have a healthy, vital bone. So that's what our system will be promoted like internationally. If you ever hear about the stable tissue concept, please refer it to the products of Argon Medical. Now, here's just a brief example of what we are talking about. This is a case where we have placed an implant 5 years ago, and you can see, it's hidden a little bit by me, how it keeps the bone, and on the clinical image on the other side, how well it keeps the gingiva. And this is what it's all about. But now coming back to today's topic, with the advantages of the full digital surgery, implantology for me means to deliver solutions. My customers here in Germany, they await solutions from me, also for the difficult cases, also for the easy cases, sustainable solutions. And this means, in many cases, digital planning. So imagine you have a case like this. This is where we have the rendering of the 3D image. The patient, of course, loves to have teeth, but as you can see, there is absolutely no bone and no idea how to place an implant. So what to do? With digital planning, we are able here to transfer this into a situation like this. That's a recapitulation of the surgery we did some 2 years later. Yeah. So this is only possible to do it with digital surgery, and we will come back to these cases later at the very end of the lecture. But there are also cases like this. For example, look at here at the upper jaw. There is no bone, not even missing teeth, and no bone. So what to do when a patient wants bone and teeth? Of course, you have to place implants, and you have to precisely plan this, and this is all possible by digital planning. Manually would be hardly feasible. We have turned this situation into a situation like this, like as you can see. We have here placed 6 implants in the upper jaw and 2 individually milled bone blocks. That's also a topic that we cover, as Ruben has already mentioned in his moderation. Please, concerning referring to this case, ignore the lower jaws. Those implants here have nothing to do with the knowledge of our doctor and of course the quality of our products. This is something very old-fashioned, and you can see very well the issues that common implants do have. So I want to speak for those who are new into the discussion about full guided surgery. The arguments that you need to consider when switching to this therapy. So with full guided surgery, of course, you can safely solve the most complicated cases, and according, of course, to forensic science. This is an aspect that is very important and getting more and more important. Because you have to consider your liability as the surgeon, and you have to properly document the whole implantation process. In fact, this is the reason why in North America, due to their different legislatory regulations concerning liability, they are placing 80% or more than 80% of the implants through the surgical guide fully guided because of the proper documentation. We will go deeper into this aspect later on. But of course, an argument that has the same importance is that with complicated cases, you can avoid hazards, like the nervus mandibuloris, of course, or entering the sinus. Yes. So another important aspect about full guided surgery is, of course, that you are able to align the prosthetics. You can align the prosthetics perfectly by the digital planning of the implant and their guided positioning. You're also able to already design the whole prosthetics, but this is a bit of a different aspect, but you can combine this. The steps forward that we are making in this respect are enormous. Then, of course, an aspect also for, I would say, standard cases or less complicated cases is that the patients keep asking the doctors about working minimal invasive. You know, they, for example, I had an implant surgery as well. I would love to have don't have any swells. My idea is to be working the next day again to relieve me from pain. And of course, with the help of full guided surgery, this is much easier for you to achieve because you can work, you might be able to work flapless. Yeah. So, and then a very, very advanced cases, in very advanced cases, you can do both two surgeries that are necessary in one session. You have seen the cases before where there was a huge bone loss and also the need for implants. So with the help of digital guiding, digital planning, you can combine both operations in one surgical session. Yes, but it's very, very important that your implant system is suitable for that. Without a suitable implant system, this will not work. Yeah? And then also another aspect, of course, when it comes to full guided surgery, you can reduce time. It's, as mentioned before, you can avoid a second session, you can work flapless, and of course you can relieve the patient's stress. So I can say my customers who are already working full guided, normally the response is enormous because they have happy patients and happy customers. So let's look this in detail. For example, here I have a case that is more or less compared to the first cases I've shown you as a standard case. We have here, we have placed the implants very, very deep. We have placed them very, very precise. They are absolutely perfectly aligned, but I mean, this would be a case that you could solve without a surgical guide, but with a surgical guide, you can align it perfectly, you can place them perfectly, you can put the abutments very deep, and this customer always insists on full zirconium crowns so that you have a very, very nice adaptation for the gingiva. And together with a conical implant, the patient is still younger one, this will last for a lifetime. This is what I can guarantee you. And the other thing is also, in this case, he used the punch. I will show you the punch later on the surgical kit. He also works flapless. And this customer has told me, well, Andreas, when switching from manual implantology to full guided surgery, to full guided implantology, by spreading the word of mouth, I have increased the numbers of patients wanting implants from me to about 100%. So he has double the patients because the patients like the idea of working flapless, of working minimal invasive. So, but now, when we go more into the detail, I want to speak about the issues that we have with fully guided surgery, especially when it comes to loose precision, because the topic is precise guided surgery and not some kind of simple guided surgery. And so first of all, we have to look at the prerequisites that we need for the fully guided surgery. If I do now use the term sometimes rapid surgery, this is because we, from the Argon group, from the K3 product, have call our approach to fully guided surgery, we call this rapid surgery. So this is the same. So the first thing you need to do a full digital planning is, of course, to have a 3D cone beam. And when doing the 3D cone beam, you need to be sure that that the device you're taking the image is convertible. The data that it creates is convertible to DICOM. DICOM is an international standard to exchange these data, but not all of the X-ray machines are, well, almost all of them are able to create DICOM data. The quality of the image is not always good, and this is something that has a reason, because they want to keep their customers in a closed workflow, yeah, without so that you are maybe stuck to certain implant systems that are coming from the same company, like the producer of this 3D cone beam. So when deciding on a cone beam, be aware, yeah, that the system needs to produce DICOM data in good quality. Same thing goes with a digitized model. So you do not generally need a scanner in your clinic. If my customers want us to plan the implant, to plan the surgery, we can digitize their model if they send it to our partner. But you can also do the digitized models by yourself if you have a lab scanner in your clinic or an intraoral scanner. But be sure that this scanner also produces STL data, because STL is the data that we need to combine the DICOM data from the X-ray with the STL with the data of the model, and we need to match that. We need to properly match that. So the next thing, of course, that we need as a prerequisite is a planning program. So it's a planning software. So in this case, you can see here, that's the very first step of the planning software. You see the bone, the DICOM data, more or less from the X-ray, how it looks like. You can also tell the X-rays by the picture. And then in this case, this is one of the cases I've shown you before, we have created a virtual bone block that is needed to place the implants. And here you can already see in the planning software, you can see the sleeves through which the implants will be placed. Yes, and this needs to be matched with the gingiva situation, with the model situation. And here you have the results. Yeah, in red you can see the gingiva. Yeah, and you can also see how the bone block will be slightly larger than the actual gingiva situation. So this is something that the surgeon needs to consider before the surgery. But you need to probably look at if this planning software is able to do this. Because in many cases, if you are buying a 3D cone beam, there will be some kind of implant demonstration software included in the price. But this software is for fully guided surgery more or less useless, because you can only display the position of the implant within the bone, but you will not be able to put a STL output that will help you to produce a surgical guide. You will not be able to match it with the STL data. So when the producer of the 3D cone beam tells you, well, there's an implant planning software included, be very careful. Ask questions. Be uncomfortable. What the software is really capable to do. This one here that you can see is one of the best. And what is also important, you can see here by the image here behind me, that this software is able. Here you can see the implant placement, the implant planning. You can see the gingiva situation, and you can also see here in green the virtual bone block. So this is really an in-depth planning. And another thing that you also need to consider when deciding for the software, is it possible to do a tooth setup? Here in this case, this software here is able, before placing the implants or planning the implants, you can do a virtual tooth setup. This does not need to be perfect, but you need to, you need to introduce in the planning your prosthetic idea that you will follow in this case. There are softwares, still not cheap softwares, still implant planning softwares that are working only surgical. You can place the implants perfectly on a surgical basis. You can place them there where you have bone to avoid augmentation, but later on you might up ending that your dental technician will ask you, well, sorry for the expression, what the hell am I supposed to do with this? You have placed the implants, it's impossible for me to place a proper crown. So please be aware, there are implant planning softwares where you can make a tooth setup like we did here. Switching to the next slide. So that's the conclusion. The planning software should include a tooth setup. So then another aspect that you can tell when approaching to the thing like a detective is take a close look at the surgical kit for fully guided surgery. Is it especially developed to place really to replace the implant fully guided, or does the manufacturer only pretend? Here we can see an overview of the system of the fully guided surgical set with very specific drills. We have them in 3 sizes because we have an implant range from 3.0 diameter to a maximum diameter of 6.0. And I think here I will switch to my webcam to give you a little bit of a better idea how a surgical kit should look like. So first of all, this is very important when you want to work minimal invasive. We are starting here with a punch. So in case, not in all of the cases where you use a surgical guide, you're able to work flapless. Honestly speaking, there are many cases when it gets complicated where you cannot work flapless. But if you want to work flapless, you need a punch, of course, and this punch needs to fit through the surgical guide. I'm just giving here I will show you more proper surgical guides before, but this one is good for practicing. And the idea is always that it exactly fits through the surgical guide here. Next thing you should consider, these are here the pilot drills. We have here, when you have removed the gingiva, you have here a battery of pilot drills. I think I better move to this position, yeah, because here you're able to see the pilot drills better. In our case, we are constantly growing. I will show you the reason why we're doing this later, from a 3 millimeter to 5 millimeters and 7 millimeters. That is the longest for the pilot drills. And again, the idea of having this cylinder is that before it has contact to the bone, the pilot drill is completely fixed here with the surgical guide, with the sleeve in the surgical guide. Right. Then we continue here in case of the 4.5 millimeter implants. These are the yellow drills here with the so-called cortical drills. These cortical drills, I take now the longest one. Oh. Here we go. The longest one here is also fixed here completely by the sleeve. And as you can see, when I wanted you to be aware, are we talking about full guided surgery or only something like half guided? The deciding point is, do all these drills have a stopper? We have here an integrated stopper. It's not a sleeve, it's integrated here with a stopper. And whenever you come across a surgical kit that has here stoppers included on the drills, then you know that you are with the right company because they're taking it seriously. After you've made your way according to the protocol down to the final drills, I will show you this later on again to you on a specific surgical protocol, you will end up with an implant inserter. Also, of course, in case of hard bone, you will have also a tap, like you can see here. The tap is also held, of course, fixed by the surgical guide. You can do all the steps, all the progress through the surgical guide. This is very important that the instruments fit through the surgical guide. Yeah, if there's some play, this will not be precise enough. And the final and one of the most important steps to avoid hazards, if you're close to the nerve or close to the sinus, is that you also have an implant inserter that has a stopper. So with this implant inserter and the guide in the patient's mouth, you're unable to push the implant deeper than it's supposed to sit. So also this is also a very, very important device to tell if you have a really full guided surgical kit with full precision. Some people keep asking me, why do you have so many drills? In our protocol, we work our way down to the very bottom pretty slowly in 2 millimeter steps, because we want every drill to be fixed in the sleeve. You can also have a different approach. There are also companies who have work in full guided systems who do just have one drill according to the implant diameter. But then if they want to properly stop the implant at the correct height, if they really want to have that depth control, then they need many sleeves to insert into the inner sleeve. And to make it like this, we want to avoid this whenever possible. One thing is, for example, I can show this here with the reduction sleeve that we have. I will talk about the sense of the reduction sleeve later. I switch to a different guide. This is better for me to hold. You can put this inner sleeve here, yeah, but the inner sleeves are tending to rotate. When you have your drill there and you're rotating, this sleeve will rotate as well. So the reason is, whenever you put a sleeve into your surgical guide, the sleeve needs to be fixed. We're doing this by this device here. So with this device, you avoid the rotation of the inner sleeve. But this means for you as a surgeon here with this, by having to fix this inner sleeve, you always, you need both hands for doing the surgery. You need one hand, of course, for your drill and your handpiece, and you need the other, the other hand, of course, to fix the sleeve. And this is what we don't like personally, and our customers don't like as well. So many have switched to us because of that principle that we want to avoid in a second sleeve. That's why we are working our way with many different drills, but you always have your hand free because there's no need to fix a second sleeve into the surgical guide. Now coming back to the topic about precision in digital guided surgery. You also can do, of course, only pilot drilling. You know, we have this sleeve here. This also this sleeve. If the customer decides for whatever reason that he only wants to do a pilot drilling without depth control, then he can switch to this inner sleeve to just put the where do I have my drill? I can take this drill from my manual tray. This is for the K3 Pro system, our standard pilot drill. Without, you know, we have some marks concerning the depth, but we do not have a drill stopper. And you can use this drill, of course, yeah, if you want to do just a pilot drilling through the guide. Then the direction is fine. But as you can see here a little bit, there is some play. Trying to show this. Now I can show it to you again. Oh, it is still in there. See it from this side. There is some play. And when it comes to the topic of precision in digital guided surgery, this is something that we want to avoid. So this is the reason why we are against multiple sleeves in the guide, because every sleeve that you need to put in costs you some precision. So, and then coming back to the lecture. Another aspect is when it comes to main issues in fully guided surgery, you need to take a close look at the implant system that you're using. Does the implant system from its design fit to the approach of fully guided surgery? And then you can see you have to be aware that there are certain screw designs that do not properly fit. For example, I have put here a screw design. It's not ours. This is a very protrusive screw design. And this very protrusive screw design, concerning that we have a relatively slim implant body, has the problem that if you do the drilling, the cavity for the implant body, you do not know what is left or right of the cavity. So whenever you have a hard structure there, yeah, most likely that this protrusive screw design will move the implant to an undesired position. Yeah, so it's a brand new slide that I made because I just had this discussion with a customer of mine some 3 weeks ago, because he has tried from a different company, of course, an implant system pretending to be full guided with a very protrusive screw. And he said, Andreas, whenever there is a hard structure close to the cavity, yeah, the implant moves because of the screw design that is too protrusive. So I mean, there are many advantages of a protrusive screw, especially in soft bone, but the precision concerning soft, it's very good in soft bone, but the precision when it comes to fully guided surgery, this is not as good as if you have a more, I would say, a more stable, a thicker implant body, a more massive implant body. You can see it here as an example here. This is also an implant that has an implant design, a screw design that is still progressive enough to give good primer stability, but we still have a massive implant inner body, so that we also have a fitting I would say cavity for this, that we can drill fully guided. Yeah, so please be aware when choosing the system of the screw design of the implant system. So, and then we we're going briefly back to the hands-on camera. Always look when deciding on the system for fully guided surgery, look for drills and instruments that allow a reduction of the cavity. If you have to face very soft bone and you don't want to lose precision, like you lose with that protrusive screw design. I will show you how this works. So I was talking before, I have been talking about this reduction sleeve. I'll switch to another. I'm going to switch to another guide. Like you can see here. Take a close look. For example, these designs here that you can see at these sleeves, they are designed for implant diameters of 4.0 and 4.5. So imagine you have planned a 4.0 implant. All the drills, in our case, they have here this some kind of pink color. You see all the drills, starting also from the very first pilot drill to the final drills, do exactly fit without any play into these sleeves. But now, as an experienced implantologist, you will probably know if you're in the upper jaw and you have very, very soft bone and you're strictly following that protocol, you might end up that you don't have sufficient primer stability in the upper jaw, especially if you have promised your patient that he will go home with some, I would say, some prosthetic solution, temporary prosthetic solutions. So to increase primer stability, you're likely to drill a little less, 0.5 millimeter less. So that means you need the 3.5 millimeter drills. And the 3.5 millimeter drills, I have them here in the different kit. You can see their cylinder design is different. It's too small to go through this sleeve. They are ideally here. Here in this case, we had a 3.5 millimeter implant placed here, or 3.0. They are made exactly for this sleeve. But this is why we do provide this reduction sleeve that you should better need to fix, like I've shown you before. With this reduction sleeve, you can plan a 4.5 or 4.0 implant and still use the 3.0 drill, because this is then, we have almost the same precision like it would be a 3.5 millimeter sleeve. When asking why not planning in advance the 3.5 millimeter sleeve, well, we're doing this with this adapter sleeve because in the end, we want to place the implant through the guide because of the depth control. I mean, this aspect now goes very much in depth, but I guess this is what you guys are all here to see that. So that means now the surgical kit is very important to decide what is really important when it comes to precision in surgical
5 minutes more to
full guided surgery. 5 minutes. Oh my God, I'm much behind my schedule. So few drills in a kit that pretends to be full guided means that this is half guided only because there is no depth control in most of the cases. Then you need to take a look at the sleeves. Many sleeves indicate that there is depth control, but they are not that easy to handle. Yeah. Then there's also, you need to consider the design of the drills. I will not switch back to the model because take a look, are the drills really suitable for slow drilling? Because you cannot cool through the surgical guide. So all our drills are designed for slow drilling. This is one reason. And then another reason is you might have seen already when demonstrating that I have many inserters here. So according to the height that you want to plan the surgical guide, you need an individual inserter. Yeah? And we can plan our surgical guide in 3 different heights according to the indication. I mean, it's toothless jaw is of course different than if we have small interdental gaps. So as mentioned before, the surgical kit, the full guided, reveals the hidden secrets of the system. Yeah, for when it comes to really precision in full guided surgery. So there are some perfection that you can do, and you can watch out for that. So one step towards perfection that we are doing is we are providing sleeves with reduced friction. This is a brand new development. There is always friction between drill and the sleeve in the guide, and we want to avoid that. So we're doing some efforts to reduce it. You need to watch out for really precision from the very beginning. So the most important thing is, if you're able to punch the gingiva, do it. This is very good for the patient. If you cannot do it, watch out that your pilot drill allows you to go to that there's no play in the pilot drilling, because with less playing of the pilot drill, the more precision you will have up in the end. So watch out if the pilot drill is really fixed by a cylinder. So watch out if there's really depth control, so that your planning can be transferred into reality accordingly. So it's always good if the height of the guide can be adjusted. Also, one thing for perfection is if you have a bone leveling drill. We have this. If we have very hard cortical bone, we can remove a little bit before drilling. And also the reduction sleeve to achieve primer stability. So then, perfection also means, is it possible with your implant system to turn a consistent surgical planning? Here you can, for example, see with this software that we have a very consistent surgical planning. We can see a tooth setup here. We can see the implant position. We can see the gingiva situation, and we can see the sleeve. So this looks like a very proper implant planning software. Another case that you can see here, this is also very nice. You can see here the sleeve. You can tell by the display of the sleeve, the position, the height of the guide, and you can see the direction. Here you see the gingiva situation. Also here you can see the nervus. This is looks like a very good planning software. And then a good planning software always gives a detailed material list. Yeah, the output when placing, when you've done the proper planning, gives you an exactly overview. What implants do you need? and what screws, what other devices you need. For example, here it also gives the exact description of the sleeve that you need to order for the surgical guide. And now the vital thing is, can you turn this consistent surgical planning into a surgical protocol, an individual surgical protocol for the patient? Yes, you can. In the cases of if you really want precision. So here, every customer who gets a planning, well, with our partners, he gets a detailed surgical protocol. And so when receiving such a surgical protocol, that tells you exactly the drills that you need. Always considering that everything is fine with bone condition, yeah, you will have a perfect result, and you can have a perfect preparation, because you can, for example, ask your assistants to remove all the other drills from the tray that you will not need during surgery. So this is also gives you a very good overview, and you just have to work more or less your way down here through the list. Normally, I would have a hands-on demonstration right now, but as we are a little bit short of that time, we will skip that. For sure, you have understood the importance of this document, because this is also very helpful in the surgery, and it's really excellent if you want to be perfectly prepared. So, Rupert, then I would skip some slides and go directly to the take-home messages, if this is fine to you.
That's fine, sir. No problem.
Good. Just one moment. I would have had so many cases for you to show, but okay, it's a huge topic, precision in fully digital guided surgery. We could say the conclusions are that it is, generally speaking, a huge improvement, even for the very experienced implantologist. Because summary, you have seen what kind of cases we solved by the help of precise full guided surgery. We have, for standard and easy cases, minimal invasive surgery possible, and this reduces trauma and pain, and this will bring you, I can guarantee you, a lot of satisfied patients who will tell by the word of mouth many people about the possibilities that they have with this approach. For difficult cases, you can avoid hazards. It considers the forensic duties that you have. It speeds up the surgery because you know which drills to prepare, and of course it gives even the very experienced implantologists peace of mind. Then, as mentioned before, the implant system that you choose, it needs to have the specific design properties for full guided placement. Otherwise, it cannot be full guided placed. Yeah. Proper planning of the case is inevitable, because take a close look at the planning software that you use or your partners use. It's the advantages and disadvantages. Examine like a detective the surgical kit that you use and the surgical guide that you receive. Are there really sufficient instruments if the case turns out to be a little bit different as planned? Are there ways to change a little bit, to switch to a plan B, more or less? And then an important aspect that tells you a lot about the precision of the implant system when it comes to fully surgical guiding is do we have a proper surgical protocol, and is it possible to do it individually on the patient's case? And in the end, the conclusion, precise guided surgery is not necessarily a walk in the park, especially if you're solving really complicated cases. But it's a great help. I do still recommend it's of course very helpful for beginners, but I of course do still recommend to work on a graduation as a certified implantologist. Okay, so I would be through with the presentation, and I'm waiting now for your questions and answers.
Let's begin with the question and answer session. We start with the first question. What is your say on dynamic and static surgical guides? Which one is better?
Dynamic or static surgical guides?
That's right.
Well, the surgical guides that we actually delivering are, in this case, I would say, generally speaking, they are static because we have to we focus on a stable material. Yeah. But on the other hand, they are dynamic. As I have showed you, we have this reduction sleeves. We can always switch, the drills that we are opting to take in case that we have a very soft bone. We can switch that. Yeah. But a dynamic surgical guide. I mean, does this refer to the material that they are soft materials? I personally have not seen them from soft material. I guess a stable material that can be sterilized is very, very important because this also avoids rotation of the sleeve in the guide itself. Yeah, but honestly speaking, if dynamic refers to soft material, I personally do not have experience with it. Same goes with my customers.
Thank you. So thank you for answering to the question. We move to the next question. How much of mouth opening is needed for a fully guided surgery in the posterior area?
I did not understand. How did the question was how much mouth opening is needed?
That's right. How much of mouth opening is needed for fully guided surgery in the posterior area?
Very, very good question. as much as possible. The thing is, as I have mentioned before, we can achieve full guided surgery also with very small mouth openings, but this is only possible because we can place our surgical guide very deep. As you have seen before, there's a possibility to have only a length of the implant inserter of 3 millimeters. This means that the guide can be placed very deep. But placing the guide very deep, this does only work normally with toothless jaws. So with toothless jaws and a deep placement of the surgical guide, it's possible in almost any case, because also the implant length that you will need won't be that much. I mean, an implant length of 9 millimeters in case of our system is absolutely sufficient. This is absolutely reliable. And then even a small mouth opening is fine. It's different, of course, if you have an interdental gap. Then you sometimes need to place the sleeve, the implant guide very high. And please be aware, if I had to leave out some slides. It's a very important point. You should be aware many implant systems do only have one fixed distance of the upper end of the sleeve of the surgical guide to the implant shoulder. In many cases, this is 10 millimeters. And 10 millimeters can be far too much. With a distance of 10 millimeters, you will have issues in the molar area if you have a small mouth opening, definitely. So take a close look. Is it possible to place the guide really very deep?
Thank you. I think that was a very detailed answer to the question. Thank you very much. So we move to the next question. Is tissue punch compulsory, or can we use laser instead of...
Please repeat, Ruben, slowly.
I'm so sorry, sir. Is tissue punch compulsory?
Sorry, the connection is weak. Once more, please.
All right, so just give me a moment, please.
Yes, now it's better.
Is the tissue punch compulsory, or can we use laser instead of tissue punch?
Yeah, no, the tissue punch is definitely not necessarily. The tissue punch is it's a recommendation that we give. But if you have good experience to do it with laser, this works as well. It works the same. I would say, generally speaking, in many cases, we use the full surgical guide because of a very complicated case where we cannot use the punch, where we cannot work flapless. But in case if you want to work flapless, the punch is a good idea to do it. But there are also, of course, due to your experience, use the way that you prefer. The punch is not compulsory.
Thank you very much, sir. We move to the next question. What implant planning software do you prefer?
Okay, this is now a question that I don't want to answer because I'm not entitled to speak about different companies than here my company and my product. I would, but what I can say, what I can answer is, well, if you go to I would say to a European company, most European companies do include all the implant systems that are available with a fully surgical protocol. Many other companies coming from other countries, they just want the customers to keep them into their closed workflow, to use their implant system. And this is normally where the issues start, because many implant systems, they do not have a sufficient range when it comes to diameters and lengths, and especially on prosthetics that are really manufactured for digital planning, for digital positioning. Yeah. So my recommendation is, I don't want to really mention names because we are also customers. We are customers of different softwares that of course all include our system, and they are all from Europe. Yeah, because there's I would say there's a larger demand for really open workflows. And be aware if these companies have a closed system, a closed workflow. This might look very simple, but then you are stuck into their system, and this is what they want. And we don't want this. So we don't have our own software for planning this. So yeah, be like a detective when choosing.
Thank you very much, sir. Last question before we wind up the session. Is guided surgery done in bone resorption cases?
Yes, you can. Of course, you can do guided surgery in bone resorption cases. We do this pretty much many times. I mean, it's especially in the lower jaw. This is quite common to do a proper planning of especially the short implants. We have short implants with a lengths of 5.5 millimeters that should be placed 1 millimeter below the crestal bone to have that bony seal. And we do this in bone resorption cases. But be aware, in bone resorption cases, the cortical bone is normally very hard and very deep. So then it's recommendable to use this bone leveler device. Without that bone leveler device, the pilot drill of the full guided system might not be able to enter the bone. Yeah, but we have these cases, and they do work well if you know what you are doing. Yeah, I would say bone resorption is a classic case to go full digitally guided.